Assalamu alaikum everyone. Today we will be discussing about gross anatomy of mandible and hyoid bone. So the first of all, we will discuss about the bony features. The lower jaw mandible is the most inferior structure in the interior view of the skull. So there are two parts of the mandible, or the body of mandible, which is present anteriorly, and the ramus of the mandible, which is present posteriorly. The body and the ramus of the mandible, they both meet posteriorly at the angle of the mandible. So the first of all, the body of the mandible is composed up of two parts, the lower part and the upper part. The lower part is basically the base of the mandible and the upper part is the alveolar part of the mandible. The base of the mandible comprises of following features. It has mental protuberance, mental tubercles, a mental foramen, and an oblique line which is passing from the front of the ramus onto the body of the mandible. So this is the body of the mandible and this is the ramus of the mandible. The body and the ramus both meet at the point which is called at the angle of the mandible. So this is the superior border and this is the inferior border. And here is the oblique line of the mandible. So this lower part of the face, the lower part of the skull, this is the mandible. So here, this is the ramus of the mandible on each side. This is the oblique line of the mandible. These are the mental foramen, and this the chin part or the mental protuberance. And these tubercles are mental tubercle. So the ramus of the mandible is quadrangular in shape and has median and lateral surfaces, interior, posterior, superior, inferior borders, and condylar and coronite processes. The borders are the angle of the mandible, posterior inferior border. The mandibular notch is notch superior border. The interior border is sharp and is continuous below the oblique line on the body of the mandible. So this is the superior border. This is the inferior border. This is the interior border, and this is the oblique line, which is the continuation of the interior border. So these two are notches. This is the condylar process of the mandible. So the processes, the coronite process, it provides attachment to the temporalis muscle, the condylar process. It extends superiorly from the posterior and superior border of the ramus. It consists of the head of the mandible and the neck of the mandible. The head of the mandible, it helps in forming the temporomandibular joint. And the neck of the mandible, it bears a shallow depression interiorly, which is pterygoid fovea. It provides the attachment for lateral pterygoid muscle. So this is the notch in between these two processes. This is the condylar process. This is the coronite process. Right. And this is the pterygoid fovea. The medial surface of the ramus of the mandible is the lateral wall of the infratemporal fossa. The mandibular foramen, it comprises of the mandibular foramen. It is the superior opening of the mandibular canal. The inferior alveolar nerve and muscles pass through this foramen. The lingula, it provides the attachment of the mandibular end of the sphenomandibular ligament. The mylohyoid groove, it is through this groove, the nerve to mylohyoid passes. The attachment of the medial pterygoid muscle posterior inferior to the mylohyoid groove and mandibular foramen. The most of the lateral surface provides the attachment for the masseter muscle. And these are the mental spine, superior mental spine, and this is mandibular symphysis. This is retromolar triangle, and this provides the attachment for the pterygomandibular rib. This is the medial pterygoid muscle. This is the lateral pterygoid muscle. The most of the lateral part of the mandible, the ramus of the mandible, it provides the attachment to the pterygoid muscle. This is the masseter muscle, and this is the temporalis muscle. So these four muscles are the muscles of the mastication. The ligaments which are associated with the temporomandibular joints are lateral ligament, sphenomandibular ligament, and stylomandibular ligament. These ligaments help this temporomandibular joint in the movement. The movements of the temporomandibular joint are depression, which is due to gravity and digastric genohyoid and mylohyoid muscles. The elevation, which is moving upward. This is due to temporalis, masseter, and medial pterygoid. The retraction, it is provided by the posterior fibers of the temporalis, D part of the masseter, and genohyoid and digastric. The protrusion, it is due to lateral pterygoid assisted by medial pterygoid muscle. So these are the muscles of the mastication. It includes the masseter, temporalis, medial pterygoid, and lateral pterygoid. Now we can discuss about inferior alveolar nerve. The inferior alveolar nerve is a major sensory branch of the posterior trunk of the mandibular nerve. It provides a sensory innervation to lower teeth, associated gingiva, mucosa, and skin of the lower lip and skin of chin. It is provides a motor innervation to mylohyoid muscle, anterior belly of digastric muscle. So this is the trigeminal ganglion. Okay. From this, the different branches, it gives off the interior trunk. And interior trunk again gives the branches to nerve to lateral pterygoid, and another is buccal nerve, which descends downwards to this part. And this is again the branch from the interior trunk is mesenteric nerve. And these are further small branches, which is branch to tensor villi palatini. And from this is the posterior trunk. And this is the branch to tensor tympani. And these are deep temporal nerves. So the mandibular nerve, the posterior trunk, it gives off this branch, which is inferior alveolar nerve. It descends downward, it gives off one more branch, which goes to nerve mylohyoid muscle, which is nerve to mylohyoid. Okay, it runs into the mylohyoid groove. Then it again descends downwards and gives off branches, which is mental nerve, and a branch to incisives, which is incisive nerve. Again, this is inferior alveoli. So what is hyoid bone? The hyoid bone is small U-shaped bone situated in the interior midline of the neck between the chin and the thyroid. It lies at third cervical vertebrae. The hyoid bone does not articulate directly with any other skeletal element in the head and neck. This is the hyoid bone. This is the body of the hyoid bone. This is lesser horn of the hyoid bone. And this is greater horn of the hyoid. So the superiorly it is attached to the floor of the oral cavity. Inferiorly it is attached to the larynx. Posteriorly it is attached to the pharynx. The hyoid bone is consists of three parts: the body of the hyoid bone, the greater horns, and the lesser horn. The greater horn, the body, and the lesser horn, which are horn. So these are the muscles which are present in the interior triangle of neck. This is the origin, insertion, innervation, and the function of these muscles. Now, these are the muscles, which are suprahyoid muscles. It includes hyoid, anterior belly of digastric, stylohyoid, and posterior belly of digastric muscles. Infrahyoid muscles, which are basically below the hyoid bone. It includes thyrohyoid, the thyrohyoid muscle, the sternohyoid muscle, the sternohyoid muscle, this goes here, and the sternothyroid muscle. Okay, now these are the infrahyoid muscles. Thank you so much.